and time for a visit from our favorite dentist, Dr. Steffany's here from Plaza Dental Group. It's time for Great Smiles. And
I'm here from Great Day.
You're right here from Great Day.
You're on
exactly.
Great Day.
Too many
Great
words,
smiles.
great.
Great.
Okay.
How's this whole
Moderately
thing
neato
been,
day. Yeah.
by the way, in that arena? How do you get recognized because of being on the program?
Yeah, sometimes. I mean, it's usually my kids, friends and parents and things like that, but yeah.
Well, I thought you were going to say your kids recognize you, but...
Occasionally. Sometimes they do. Well,
right,
I think they try and do this most of the time,
So this morning we're talking about making your smile look even better.
Yeah, because we like to smile. It's good. Yeah. People perceive you by the way that you smile, and you've seen. Have you all seen the kind of it's not a game, but like an exercise or a thing where you can decide if people are smiling for real or not. And so you take two pictures of somebody and which one is their real smile, and the real smile is the one where their eyes light up and they really feel good about their smile, and they feel good about something else probably, but there's a big difference between the way that we perceive people that smile for real and people that don't. I mean, even though they say that most communication is nonverbal, and so our body language makes a huge difference. And I think the smile is probably the most important thing of the whole thing. And so so we're going to talk about different ways that you can get a better smile. So Invisalign is actually a huge company now. I mean, probably 15 years ago, nobody had ever heard of them. And then all of a sudden, there's this huge, name, and of course in my world, maybe not everybody else's, but Invisalign is the #1, largest company for straightening teeth in the world. And it's because they gave a different way for people to do it. So you don't have to wear braces. You put in, a tray. You wear it all the time, most of, like 20 to 22 hours a day. But you can take it out to eat and brush and floss and do all the things that you want to do. So it's very popular with people that are, especially adults, that just don't want to wear braces and they want to straighten their teeth anyway.
Because a lot of people might want a perfect smile. I think we all do. We enjoy having them. But yeah, the idea of having braces when you're an adult.
Yeah.
Not that people still don't do that, and not that there aren't great.
No, they're great options, right? Exactly.
But people sometimes are turned off by the idea of having.
I didn't realize that Invisaligns weren't attached. I thought
they're not attached.
They were attached. I just thought they were clear.
Yep. Nope. They're clear, but they come in and out. So they're actually like a clear aligner or a tray that people wear, and so you can see the befores and afters. I mean, they're really dramatic. They're really exciting. And you can see even though somebody has halfway decent smile before, when they have a great smile, they really do smile differently, and it is more attractive.
I know every situation is a little bit different, but how many trays would you be going through to correct a smile?
It's really variable. I mean, you can do any. So you wear each tray for 2 weeks, and of course you brush them and clean them in between so they don't get gross. But
we hope. Please clean your trays.
But each tray you wear for 2 weeks, and it can be anywhere from 10 to. Gosh, I've had people that are 50,
Really?
I mean, so every 2 weeks, from a few months to at least 2 to 3 years. So,
do you get scanned every time, or how does that work?
No, actually, so everything is digital. Everything is digital, and it's really cool. It's a really cool process. I tell when people want to kind of know the technology behind it. So we do digital scans, and we don't take those goopy impressions or whatever. We do digital scans, and we send those in, and then they set it up on their software program, and I manipulate. I get to move the teeth around in space. It's pretty cool. And then we take from zero to finished. I mean, to the quote perfect. It's not nothing's perfect, folks. Just so you know. But zero to the way that we want it, and then they stage it out. So then each aligner has 2 week stage, and so then. What we do is if we need something corrected in the middle, then we can do that digitally. But yeah, it's just a really cool process. I mean, people really it's amazing. And all of the aligners are cut out on a robot arm, so they're very precise. So a robot cuts them all out, and it's great technology, amazing technology. Yeah.
Because I imagine there's only so far you can move a tooth in a 2 week period.
There's only so far you can move, or should.
Right.
You could. You can
Hockey
move it a long
players
way.
do it really quickly.
Yeah, right. But you shouldn't move them too far.
Is it painful when you have that type of thing?
So here's what's really interesting about pain in the mouth. Yes, at first people get tender and sensitive, just like you would with braces, because you're moving things. You're putting pressure on something. So anytime if I did this for too long, you'd get a bruise. You get pressure would build up. But usually people have the most pain the first couple of liners when their brain is kind of getting used to the pressure, and then as their teeth start to move, then the pain and the pressure is much, much less. So most people after the first few weeks, they say it's really not that bad.
Now,
So,
if you don't want to deal with...
most people don't even take ibuprofen or Tylenol or anything like that for it.
How do you deal with it? Yeah.
No, I mean, if you need to, you can take ibuprofen or Tylenol. You realize, by the way, that there's like this giant chasm of people, like pain-wise. You know, some people can handle their arm being chopped off, and some people can handle like, you know, nothing, right? Yeah. So I mean, there's
Now, if you don't want to deal
differences.
with trays, if you know you didn't wear your retainer and when you're a teenager, you probably aren't going to wear something like that. Now, there are other options if you are wanting to straighten.
Yeah, I mean, what's really great is that, I mean, in our office, it's pretty much, 6-month smiles, which is clear braces like Jackie wore, and then there's Invisalign, which is, removable. Yes, Invisalign takes, we call it compliance. It takes a little bit of discipline, and, you actually have to want to wear them and to do the work. It's really not work. You pop a tray in.
Right.
But yes, and if you know that you're not, and I've had patients walk in the door and say, I know I'm not going to wear those. I'd love to, but I know I'm not going to. And so then we put them in 6-month smiles if they're
All right,
candidate.
cost-wise, one compared to the other.
Cost-wise is actually pretty similar. I mean, there really isn't a whole lot of difference. I mean, braces, have always been, a chunk. It's always been like, $4,000, $5,000, $6,000. And so, in our area, straightening your teeth can be anywhere from like $4,000 to $7,000, depending on what you're doing and the length of time and that kind of thing. So.
All right. So people want to come over and have you take a look at them. What's the easiest way to do so?
Easiest way to find us is dmsmiles.com. That's the fast, easy way. Most people use the internet anymore to find us, but you can also use 612-7148.
There you go. Yeah.
Or just stop by and visit.
Or just stop by and visit.
Stop by and visit. Go visit with you.
Hey.
Fine.
Wonderful. Good to see you.
Yeah, you too.
Thank you so much.